Measuring using a rigid cystoscope. To ensure accurate measurement of the stricture, the penis must be held in a fixed position. When the cystoscope has reached the proximal end of the stricture, place the first peg on the cystoscope at the end of the penis. Withdraw the cystoscope until the tip is at the distal end of the stricture. Place the second peg on the cystoscope at the end of the penis. Use the ruler from the measurement kit to measure the distance between the two pegs, from one leading edge to the next leading edge. Measure the stricture repeatedly until two similar measurements are obtained. If the distal end of the stricture is close to the meatus, measure that distance to be sure there is space for the distal expansion. Choose a stent length that covers the complete stricture with the non-expanded part of the stent. Determine the right MEMOKATH length. Rigid cystoscope plus 10 mm. Gently loosen the black securing nut at the end of the insertion system. Replace the mandrel inside the insertion system with the optic from a rigid cystoscope until the lens reaches the end of the insertion system. Gently lock the black securing nut at the end of the insertion system. Place the extension tube on the horizontal port on the three-way stopcock. It is all set for the hot sterile fluid. Connect the tube with normal irrigation fluid on the vertical port on the stopcock. Connect the second extension tube to the red side port to prepare for the hot fluid. Lubricate and fill the urethra with plenty of gel just before inserting the MEMOKATH. Do not open irrigation fluid before the MEMOKATH is inside the urethra. Advance the cystoscope until the MEMOKATH is approximately 5 to 10 mm above the proximal end of the stricture. Turn off the irrigation fluid by turning the three-way stopcock. Then open the horizontal port on the stopcock. Flush 50 ml, 55 degrees Celsius sterile fluid through the extension tube connected to the three-way stopcock and the extension tube on the red side port. When the fluid reaches the MEMOKATH, both ends of the MEMOKATH will expand. Gently loosen the black securing nut. Pull the optic back inside the insertion system until the optic is distal to the MEMOKATH. Hold the outer sheath steady. Under direct vision, gently retract the joined inner sheath and the optic from the rigid cystoscope entirely. Retract the outer sheath. Verify that the MEMOKATH is in the correct position by advancing the cystoscope up to the distal part of the MEMOKATH. The urologist may also observe the proximal part of the MEMOKATH to check the expansion. This is done by gently passing the optic from the rigid cystoscope, or, if possible, an X-ray with contrast media in the urethra can be done to verify the MEMOKATH position. For further instructions, consult Instruction for Use.